Hello everyone, I'm Dr. Kiang. I'm a clinical oncologist from the Malaysian Oncological Society. Today I'll be sharing with you on radiotherapy as well as some of the common questions being asked by the patients with regards to radiotherapy itself. Radiotherapy is actually one of the treatments being used to treat cancer. Besides radiotherapy, there are other treatment options like surgery, chemotherapy, targeted therapy, immunotherapy, and the others. Radiotherapy is actually not a substitute among these options, meaning that you cannot say that you just choose radiotherapy and not to have the others. So based on the type of cancers, the stage, the doctors will actually assess and then make the recommendation on what will be the most suitable treatment or a combination of all these options to the patients. And radiotherapy actually uses radiation, like an X-ray, and then to shine on certain parts of the body where we wanted to treat the cancer itself. There are actually few types of radiotherapy. So one of the commonest one that we call is called external beam, where we actually use the radiation to shine on the parts of the patient that we wanted to treat from the outside. Where the other types of radiotherapy is what we call brachytherapy, where we will put in an instrument or a probe into either the tumors or a cavity, for instance, the vagina, right? And then to give the radiation through that instrument itself. So depends on the types of cancer and the stage. Not everyone will require the brachytherapy. So for certain patients, certain tumor types, then there actually might be a need for a combination of both the external beam radiotherapy as well as this brachytherapy. Firstly, when the doctors, after assessing the patients and the disease itself, then the doctors will make the recommendation for radiotherapy. So before everything starts, the doctors will generally explain to the patients about the radiotherapy, the intention of the radiotherapy, the dose, and the number of fractions, as well as the site where we're going to give the radiation to the patients. At the same time, the doctors will also explain to the patients regarding what are the potential side effects from this radiotherapy, and before the doctors proceed to get the consent from the patients. So the process for radiotherapy will start subsequently what we call simulations or planning. So simple term is that, for instance, say you have a piece of land, you wanted to build a house. You can't be just going to that piece of land and just build it there and then without having any planning. So of course, before that, you need to have some planning, like you need to have a plan, you need to decide on how many rooms to build, what are the materials to be used and all these things. So all this takes time as well. So same goes for radiotherapy. Before we actually start the radiotherapy itself, we need this planning. So that's where this simulation comes in. During the simulation process, what the patient needs to do is basically just lie down on the treatment couch, relax, don't move, and then the team will actually get some markings on the patient, on the site where you want to give the radiation, get some measurement as well as and to perform a scan. So all this information gathered during the simulation will be used during the radiotherapy planning. So normally after the simulation, it probably takes a few days for us to actually plan the radiotherapy treatment before the patient actually starts the radiotherapy session itself. So it depends on the number of sessions. Generally, patient needs to come every day. For example, if let's say the session is 5 fractions, then patient needs to come continuously from Monday to Friday, every day for the radiotherapy session once a day. For each radiotherapy session, the duration for the radiation itself normally takes between 10 to 20 minutes. But sometimes it will take longer is because we need to verify, that means the doctors and the team need to check to make sure that the area that we are going to treat is the same, right? And then everything is according to what we have planned previously. So all these verification processes sometimes takes a bit longer. But the actual radiation itself, where the radiation is continuously being shined to the site where we wanted to treat, generally takes about 10 to 20 minutes. Generally, we do not encourage the patient to miss any session if possible, unless there is something unavoidable, or if, let's say, the patient has any underlying medical issues which causes them to not able to continue with the radiation session. Depends on the treatment that we are delivering and the types of cancer that we are treating. In certain cancer types, for instance, like cervical cancer, nasopharyngeal cancer, we try not to encourage any missed session during the whole treatment durations. But for other tumor sites, for instance, like radiotherapy to the breast, or radiotherapy to the pelvis for rectal cancer, for instance, if it is unavoidable, then to miss 1 or 2 sessions is possible. I think generally it is very important for the patients to be aware of their own conditions, because we tend to actually compare, with hearsay or some other people, what has been done or what are the side effects they have suffered and all. I think it's always very important for the patient actually to know their own situation, because everyone is actually different, and the treatment that is being delivered or suggested to them might be different as well. So always talk to the doctors based on the condition, what will be the side effects of the treatment that the doctor suggested, as well as to what are the advice that you can get from the doctors to minimize the side effect, so that you can actually safely undergo and finish off the treatment, and cure off the disease.